I want you to imagine, just for a second, waking up, or maybe just walking down the street, and out of nowhere, your chest gets incredibly tight.
Right, like you can't breathe at all.
Exactly. Your arms are going completely numb, your heart is just racing, and you have this overwhelming, inescapable sense of doom. Like you are absolutely certain you are dying.
It's terrifying.
Yeah, it really is.
Mhm.
And for literally millions of people, this exact scenario ends in an emergency room visit. They're convinced it's a fatal heart attack. They get hooked up to the EKG, they wait around, and then a doctor walks in and just says, hey, your heart is perfectly healthy.
Which is just a massive biological paradox, if you think about it. I mean, your body is entirely convinced it's fighting for its life, but the environment around you is completely safe.
Right, there's no actual threat. And if you're listening to this and you've never experienced that gap yourself, you might be tempted to think, well, just take a deep breath. Just calm down. It's all in your head.
Oh, I hear that all the time. But structurally, biochemically, it is absolutely not just in your head.
Exactly. So that's what today's deep dive is all about. We are unpacking the clinical realities of panic disorder. And we're using insights and treatment protocols from Coping and Healing Counseling, or CHC.
They're a telehealth practice serving all of Georgia.
Yeah, exactly. So our mission today is to separate the myths from the medical facts. We're going to look at the surprising snowball effect of this disorder and talk about these incredibly effective brain rewiring treatments that you could literally do from your own couch.
Which is huge for accessibility. I mean, understanding the mechanics of what happens during these episodes is really the first step in dismantling that fear.
For sure. But before we get into the heavy biology of it, I was trying to come up with an analogy for this, and it feels like having a highly sensitive car alarm system installed in your central nervous system.
Okay, I like that. A car alarm.
Yeah, like
Yeah.
the alarm system itself is actually engineered perfectly. The blaring sirens, the flashing lights, the immobilizer, it's doing exactly what it's supposed to do to protect the car.
Right. It's highly functional.
But the issue is that the alarm is going off because, like, a single dry leaf gently brushed against the windshield. It's not a burglar smashing the window with a crowbar.
That is a perfect way to look at it. Taking that a step further, the adrenaline suddenly flooding your system, that's the siren. What you're experiencing is the evolutionary fight or flight response.
Right, the survival mechanism.
Exactly. Thousands of years ago, if you encountered a predator, your body needed an instant, massive dump of adrenaline to either fight for your life or sprint away. Your heart rate skyrockets to pump blood, your breathing becomes rapid to take in more oxygen.
So the alarm works. It's just activating completely out of context.
Precisely. It's a false alarm, but the siren is just as loud.
Well, since we're talking about this physical alarm,
Mm.
we really need to look at the timeline of that siren. The clinical literature outlines a surprisingly strict window for a panic attack.
Yeah, they typically peak within about 10 minutes.
10 minutes. I mean, that sounds fast on paper. But when you're trapped inside that physical sensation, 10 minutes has to feel like an eternity.
Oh, absolutely. And they usually resolve completely within 20 to 30 minutes.
Wait, why is it so strict? Why 30 minutes?
It comes down to basic biology, really. Your body simply cannot sustain that massive, concentrated dump of adrenaline indefinitely. The system just burns incredibly hot, it peaks rapidly, and then your body's natural metabolic processes are essentially forced to step in.
So the body cleans it up automatically.
Exactly. Enzymes start breaking down those stress hormones, clearing the chemicals out of your bloodstream. The physiological symptoms literally have to subside within that specific window because the fuel is gone.
Wow. But during that 20 or 30-minute window, the list of symptoms is staggering. I mean, we're talking palpitations, heavy sweating, trembling, chest pain, nausea, dizziness.
It's a massive systemic overload.
Yeah. But there are a few uniquely terrifying sensory symptoms the source material highlights. I really want to unpack the how and why behind them, starting with paresthesias.
Paresthesias, yes, that's the clinical term for numbness or tingling, usually in the hands, feet, or right around the mouth.
Which is exactly why people think they're having a heart attack,
Mhm.
right? Because your left arm goes numb. Why does that happen?
It's fascinating, really. When the fight or flight response triggers, you often begin to hyperventilate. You're taking these fast, shallow breaths.
Right, trying to get air.
Exactly. But that rapid breathing actually causes the carbon dioxide levels in your blood to plummet. And when your CO2 drops, your blood pH actually shifts. It becomes more alkaline.
Wait, your blood chemistry literally changes in real time.
Yes. And that chemical shift forces the blood vessels in your extremities to constrict. So there's literally less blood flow reaching your fingers and toes, which creates that terrifying numbness and tingling.
That is wild. So it's a direct mechanical reaction. It's not just some vague, anxious feeling.
Not at all. It's basic plumbing and chemistry.
Okay, so that's the physical side. But then there's the psychological side, specifically derealization or depersonalization, where people feel totally detached from reality or like they're watching themselves from the outside.
Yeah, like watching a nightmare unfold. Derealization happens because the amygdala, which is the fear center of your brain, has essentially hijacked your cognitive processing.
Hijacked it how?
Well, your brain becomes so hyper-focused on this massive perceived internal threat that it literally stops processing external sensory information normally. It narrows your bandwidth, so to speak.
Oh, so the outside world gets blurry because your brain is using all its RAM on the internal panic.
Exactly. The outside world feels foggy or simulated because your brain is dedicating every single ounce of energy to the internal survival crisis.
Wow. Now, we should clarify. Just having one of these severe attacks doesn't automatically mean you have panic disorder, right? The diagnostic threshold is much more specific.
Right. To be diagnosed with panic disorder, it requires recurrent, unexpected attacks.
And there's a second half to that criteria that I think really highlights the psychological burden of all this.
Yes. You must experience at least 1 month of either persistent worry about having another attack, or you have to show significant maladaptive behavior changes, like drastically altering your life to avoid triggering one.
Because plenty of people might have one panic attack during, say, extreme stress,
Yeah.
like college finals or a bad breakup.
Exactly, and they might never have one again. The disorder is really defined by the ongoing aftermath.
You know, it's deeply ironic. It almost seems like panic disorder is more about the anticipation of the attack than the attack itself. It's this fear of fear.
That's the perfect phrase for it.
Because the attack lasts maybe 30 minutes, but the dread of the next one, that becomes a 24-hour psychological burden. You just start scanning your body constantly, like, is my heart beating a little fast? Did I just take a shallow breath?
And that hypervigilance actually makes you more prone to triggering the alarm again.
Yeah.
If you are constantly scanning the windshield for a leaf, your nervous system is stuck in this elevated state of tension.
The baseline is just too high.
Exactly. It lowers the threshold for the next misfire.
And this fear of fear is incredibly isolating. When you look at the demographics, you can really see how this isolation snowballs into a shrinking world. The data says it affects roughly 2 to 3% of U.S. adults annually.
Which is millions of people.
Yeah. And the onset usually hits right around late adolescence to early adulthood. Plus, women are twice as likely as men to develop it.
Right, and think about that age group. Late adolescence and early adulthood is fraught with massive life transitions. Leaving home, starting college, getting your first real job.
Super stressful times.
Exactly. And the brain is still undergoing significant structural pruning during those years. So when the disorder takes root then, it can severely alter a person's life trajectory. And that leads to the specific snowball effect you mentioned. Roughly half of the people diagnosed with panic disorder also develop agoraphobia.
Now, I think most people hear agoraphobia and just assume it means like a generalized fear of leaving the house. Hermit behavior.
Right, but in this context, it's highly specific. Agoraphobia here is the fear of places or situations that might cause panic or helplessness or embarrassment if an attack happens.
So imagine having a massive panic attack while you're standing in line at a crowded grocery store.
Your amygdala incorrectly tags grocery store as a life-threatening environment.
And boom, you just completely stop going to that grocery store. You drive 20 minutes out of your way to a small corner store at midnight just to avoid it.
Exactly, avoidance.
Then maybe you have an attack on the highway. So you stop taking the highway, you only take back roads. Your world literally begins to physically shrink. The avoidance behavior just gathers speed.
It does, and it impairs your ability to function normally.
And this snowball is fueled by some massive misconceptions. We already touched on the heart attack myth, which drives so many ER visits. Then there's the fear of going crazy.
Right, even though panic attacks absolutely do not cause psychosis or insanity, that's a huge myth.
And the third misconception is people thinking they're permanently trapped, that they can't leave the house anymore, completely unaware of how treatable this actually is. But wait, I have to push back for a second on the ER thing.
Go for it.
Put yourself in the patient's shoes. If my chest is literally aching, I'm dizzy, and my hands are completely numb, and an ER doctor just runs a quick EKG, looks at his clipboard and says, hey, you're fine, go home.
It feels dismissive.
Yeah. How is a patient realistically expected to just believe that?
It's incredibly difficult. The gap between the patient's physical sensation and the mental reality of safety is enormous in that moment. But you have to understand the ER doctor's primary objective.
To make sure you're not actually dying.
Exactly. Their sole job is to rule out an acute, life-threatening cardiac event. Once they confirm there is no blockage or tissue damage, they've basically reached the limit of their emergency scope.
Because it's not a heart problem, it's a brain problem.
Right. They are not equipped to treat a neurological misfire in a triage setting. Closing that gap, aligning what your body feels with what your brain knows, requires specialized, evidence-based therapy.
And that perfectly bridges us to the gold standard treatments. This is where we actually talk about rewiring the brain. The clinical insights point to cognitive behavioral therapy, or CBT, as the first-line treatment.
Specifically CBT featuring something called interoceptive exposure.
Interoceptive, meaning sensations inside the body.
Exactly. Usually a standard course runs about 12 to 15 sessions. And what this does is deliberately bring on those terrifying physical sensations like racing heart, the breathlessness.
Wait, on purpose?
On purpose, but in a safe, completely graduated way under clinical supervision.
So it's basically a fire drill for your nervous system.
Yeah.
You purposefully set off the alarm in a controlled environment so that when a real spark happens, you don't panic. You know it's just a drill.
I love that analogy. In a clinical setting, a therapist might literally instruct you to spin in a desk chair for 60 seconds to intentionally induce severe dizziness.
Oh, wow.
Or they might have you breathe rapidly through a narrow cocktail straw to simulate shortness of breath. You trigger the physical symptom, and then you just sit with it.
You don't run away.
No fleeing, no rushing to the hospital. You allow the brain to experience the intense sensation and process the reality that you are actually safe.
The brain basically gets bored with the alarm and realizes there's no real fire.
The clinical term is habituation. The amygdala slowly learns that a rapid heart rate does not equal imminent death. You are forcing the brain to unlearn the association between those sensations and danger.
That's incredible. The source material also mentions medications playing a role, right? Like FDA-approved SSRIs, things like sertraline or escitalopram.
Yes, SSRIs can be incredibly helpful because they address that hypervigilance we talked about.
The constant scanning.
Right. By altering the serotonin balance over time, they essentially lower the baseline sensitivity of your nervous system. If your baseline anxiety is lower, it takes a much larger leap to trigger the car alarm.
Makes total sense. But there is a massive caveat in the notes regarding benzodiazepines, those fast-acting sedatives.
Yes, they have a very limited role in long-term treatment.
Because if the whole goal of exposure therapy is to feel the sensations and learn they're safe, taking a sedative would just cancel the fire drill entirely.
You nailed it. You absolutely cannot train the brain to tolerate physical sensations if a medication is actively numbing those sensations from occurring.
It defeats the purpose.
Exactly. Benzos carry dependence risks, sure, but their main drawback here is they rob the brain of the opportunity to learn. The patient attributes their survival to the pill instead of their own body's ability to ride out the adrenaline wave.
Oh, that's such a crucial distinction, which is why specialized therapists prioritize CBT with exposure and maybe use SSRIs to lower the baseline.
And we're also seeing mindfulness-based therapies used as great complementary tools, teaching patients to observe their body with curiosity rather than instant terror.
Right. So if the most effective treatment, this exposure therapy, requires practicing these fire drills in real-world environments, we really need to talk about the telehealth advantage.
Yes, accessibility is everything.
Let's talk about when someone should actually reach out for help. The guidelines mention recurrent attacks, repeated ER visits, avoiding places, but they also highlight nocturnal panic attacks, which honestly sounds like a whole different level of distress.
Oh, it is. Nocturnal panic is when the biological alarm misfires while you are completely asleep.
So you just wake up in full panic mode.
You jolt awake from a dead sleep in a state of absolute physiological terror, heart pounding, gasping for air, and it severely disrupts sleep cycles because the bed itself becomes associated with the trauma.
That sounds exhausting. And because in vivo exposure, meaning doing the therapy in real life, is so vital, telehealth becomes this massive clinical advantage.
Right, because you are in the actual environment.
Exactly. Coping and Healing Counseling, or CHC, operates entirely via secure, HEPA-compliant video across all 159 counties in Georgia. You don't have to drive to a sterile clinic. You can do the work in your exact living room, or even sitting on the exact bed where the nocturnal panic happens.
Treating the panic where it lives is profoundly more effective. If your avoidance centers around your home office, having the therapist on the screen, guiding you through a hyperventilation exercise right at your desk, it contextualizes the healing process. A traditional office visit just can't replicate that.
And the logistical details here are huge, because the fear of fear feeds on avoidance. If a patient finally musters the courage to ask for help, and they're told, oh, it'll take 6 weeks for an intake, or it's $200 out of pocket.
That friction is just an excuse to keep avoiding the problem.
Exactly. CHC has a diverse, culturally competent team of over 15 licensed therapists. We're talking LCSWs, LPCs, LMFTs. They serve teens 13 and up and adults. But crucially, they offer same-week scheduling.
Speed of access intercepts the avoidance cycle. When you catch the snowball before it turns into a massive avalanche, the clinical outcomes are just drastically better.
And they remove the financial friction, too. This is the game changer. For Medicaid patients in Georgia, there is a $0 copay.
$0. That's incredible.
And for commercial insurance like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, Humana, it's typically just $10 to $40 a session. Removing those administrative and financial barriers truly democratizes access to this life-changing intervention.
It ensures that evidence-based treatment can actually reach the people suffering in isolation.
Absolutely. By the way, anyone in Georgia who needs to start this process can go to cheesetherapy.com or call 484-832-0102.
That's a great resource to have.
So, to bring this deep dive all together, panic disorder is an intensely physical, deeply frightening biological misfire. It completely hijacks your body's survival systems.
But through habituation, interoceptive exposure, and the reach of telehealth, it is highly treatable. It's not a life sentence. The symptoms mimic danger, but they do not equal danger. The alarm can be rewired.
I want to speak directly to you for a second, the listener. If you or someone you love are secretly dealing with this jolting awakened terror at night, or subtly altering your life to avoid a trigger, please hear this. This is a recognized medical condition.
It's just a biological mechanism firing out of context.
Right. It is not a weakness. It is not a personal failing. And help is highly accessible.
The science behind exposure therapy offers a real mapped-out path to getting your life back.
I want to leave you with one final kind of provocative thought to ponder today. Think about the sheer raw power of the human mind. If your brain is powerful enough to physically simulate a life-threatening heart attack,
Changing your blood pH, constricting your blood vessels.
flooding your entire system with absolute terror, all from a simple misfiring fear response. Just imagine what incredible things that exact same mental horsepower can achieve when it's properly trained, deeply understood, and pointed in a positive direction. When you finally learn how to tune that sensitive internal system, the power of your own biology is entirely yours to command.